Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Here to talk about chlorpheniramine, an overview of the medication chlorpheniramine. I'm going to touch on the uses, the dosage, as well as the side effects. As with all my videos, there's a disclaimer. This is for informational purposes only. You can read the full disclaimer in the video description below. So what is chlorpheniramine? Or you sometimes see it listed as chlorpheniramine or chlorpheniramine maleate. Same thing. You can just think of chlorpheniramine maleate as the full name. It's a first generation antihistamine, or sometimes referred to as one of the older antihistamines. Of course, it blocks the histamine H1 receptor. Many people simply just call it an allergy medication. In the US, it's available in many products. Brand names do include Trimeton, Allerchlor, and many more. It's often used in combination products as well. It used to treat allergic rhinitis, so sneezing, itchy, watery eyes, itchy throat, runny nose is what it's indicated for. And I like to keep it on hand for cough. This is really good for that cough, especially that cough when you lay down at night and your throat starts to tickle due to drainage from sinuses. I find this is my go-to medicine for that type of cough. So a typical dosing, it's available in tablets. The most common are the 4 milligram tablets, also 8 milligram and extended release 12 milligram tablets are available. There is a syrup, a 2 milligram per 5, but what I see the most is the 4 milligram tablets. Can be taken with or without food. Typically every tablet every 4 to 6 hours. Myself, if I'm using it during the day, I will take a half a tablet every 6 to 8 hours. Sometimes it can give me that relief from allergies without the sedation that we'll talk about in a moment. Extended release, 12 milligrams every 12 hours, so twice a day. So how long does it take to work? Peak effect in about an hour and a half. Many people will notice improvement in symptoms within the first hour. Half-life considered to be somewhere between 14 and 24 hours, meaning that you'll notice that duration of action at least for half the day, if not a whole day after a dose, depending on the size of the dose you take. Most common side effect, drowsiness. That is the most common side effect with those older antihistamines is that they can cause drowsiness, and that does limit the usefulness of this medication. But for one of my favorite uses, that cough at night, that is a welcome side effect. Other side effects can include headache, fatigue, dry mouth. We can even get some double vision sometimes, stomach pains, and difficulty in urination. So if you already have some prostate, some urination, difficulty emptying the bladder, you have to be real careful with antihistamines that can worsen the issue. Rarely it can cause seizure and heart rhythm problems. That is extremely rare though. Other warnings and considerations with chlorpheniramine. Want to be careful with the mental alertness. It can slow your reaction time. You need to be real careful if you're using it during the day and you're driving or anything else that requires alertness. Caution if you've had a history of bronchial asthma, glaucoma, or high blood pressure. You probably want to run it by your doctor before you use some of these older antihistamines, as there's the potential for chlorpheniramine and the first generation antihistamines to worsen those conditions. Sedation risk is higher in the elderly. So again, we can't be too careful about that sedation. The drowsiness could make you more apt to fall, break a bone, something like that. So do keep that in mind. And we want to avoid taking it with other medications that can cause sedation, and avoid with things like alcohol that can cause sedation, because the two together can cause even more sedation, obviously. All right. Well, I want to thank you for watching. Please like and subscribe.